So the night before, I put my shoes out, intending to run, and the next morning I stay in bed. And this is, of course, an example perhaps of myopia, where I mispredict, where I, when I experience the condition in the future, I make different choices from the one I planned. And this is potentially a major problem for many of us as we are at risk for being sedentary, having difficulty forming exercise habits, and therefore potentially incurring excess health burdens, potentially lost work and costs. So the behavioral economic perspectives on this difficulty of forming habit we've talked about a lot. We're going to focus on sophisticated hyperbolic discounters who recognize that they have this problem of sneakers in bed, sneakers in bed, sneakers in bed, instead of maybe actually putting on the sneakers. We're going to talk about these folks because they have a demand for pre-commitment where they bind themselves to the mass so that maybe we'll put on the sneakers. Obviously, there are also naive hyperbolic discounters. We're going to essentially assume that we have very few of those in our sample, since we're going to be looking at people who are taking up pre-commitment contracts. So the pre-commitment contracts that we're going to look at in the context of exercise are the following. You'll commit to doing something for a period of time, for example, exercising 3 times a week for the next 12 weeks, and also to maybe some penalty or stakes, pay some amount of money for each week that you fail. And later, the net costs are different, and hence there's some increase in putting on the sneakers and going out and jogging. So first, I'm going to talk a little bit about our study. We had 3 questions. So do nudges, which I'll talk about exactly what these nudges were, change what people choose for their contracts at the time that they're choosing the contracts, change how they perform in the contract period, and most importantly, and related to a lot of what people have talked about earlier today and yesterday, change their demand for subsequent exercise commitment and or exercise. So we're using stick.com. You can have a goal, you have stakes, you have somebody maybe who's going to verify you. We're going to focus on the goal, where there's 2 things. There's the number of days per week that you're going to commit to exercise. That's not randomized. And what we did randomize is the number that appeared in that box by default that you could just simply delete and change if you wanted to. And people were randomized to 8 weeks, 12 weeks, or 20 weeks as the default. That's the only change. Other than that, they proceed on through. So we're going to look at about 9,000 people in the cross-section. This is the time is on the x-axis, and this is the number of people enrolling in each of these time periods. And you can see, obviously, that there's a New Year effect. And we've also looked at whether any of the other stuff I'm going to show you is different by the New Year effect, and it's not. So all groups were balanced on their observables, and all groups took up contracts that, having shown up at the website about 73 to 74% of the time. So do duration nudges shift people's chosen contracts? It changes the number of weeks that they choose by about 6 weeks between the 8-week nudge and the 20-week nudge, and it doesn't change in a statistical sense, or really in terms of an appreciable effect size, any of the other dimensions that they could choose on. So yes, we get an effect. Now we're going to look at those people taking up contracts in an earlier period, so we can have at least 6 months of follow-up on everybody, the length of their contract, or 6 months. Within contract at how well they performed. And what we find is that, on average, for people in the 8-week contracts, they were successful 3.2 weeks for 3.2 weeks. In the intention to treat analysis, the 20-week group had a slightly increase that was statistically significant. Those are 95% error bars. And in the treatment on the treated effect, sort of similar to what Scott talked about before, again, we get, with bootstrapped confidence intervals, we get a significant effect for the 20-week group. So yes, longer nudges increase the number of successful weeks performed in the contract period. So the last study, and what I'm going to focus on, both in terms of the study results and then the rest of the talk, asks the question, do nudges shift demand for subsequent exercise contracts? So we're going to look at 4,600 people roughly who had at least 1 day of follow-up at the end of their contract, so I could look at the rate at which they took up a second contract. And our hypothesis is going to be that larger nudges will induce stronger habits in more people, meaning that they're going to be more likely to take up subsequent contracts. So roughly 10% of people signed up for a second contract. In the intention to treat analysis, there was a trend towards greater take-up in the intention to treat analysis, significant at like the 0.1 level. And in the treatment on the treated analysis, it becomes significant. So This is interesting to us and I think important, and I think it gets back to something that David Leibson mentioned in terms of his student paper. Longer nudges promote exercise habit formation via greater subsequent demand for pre-commitment. So this is sort of work that we have completed, analysis that we completed up to about a year ago or so. We were sort of thinking about what theory would explain this and what would such a theory say about the welfare implication of nudges. So the remainder of what I'm going to talk about is on that. So I have to be thankful for a lot of people who have made what I'm going to talk about now. I can go a little faster because you've seen it a few times before. So this is our example person at several time points, at 4 time points. She chooses an exercise level and has some plan about how her future selves will, the exercise levels that they will choose. And that produces total utility for her cap U1. Similarly, having received E1 as an endowment, the second period does the same thing, and so on. So, of course, this person is a hyperbolic, in our model, is hyperbolic or non-hyperbolic, but is discounts the future in terms of how she forms her cap U, and likewise for the other folks. I think I use a notation that's flipped from how most people do what beta and what delta is, so just to highlight that. So we're going to have delta less than 1, and that's going to be our indicator of myopia. So our period utility kind of comes from 3 sources: exercise, other consumption, and what I'll call exercise habit. We assume that we don't like exercise, that's why people have trouble doing it. We like other consumption, and we like having exercised. That's great to be able to sort of think about it afterwards, either because I feel more healthy, I'm protected, whatever it is. So in terms of habit formation, we're going to use this sort of Stigler and Becker and Murphy kind of thing, and K, this quantity of habit, depreciates at rate gamma and is a function of previous exercise. So I can influence the utility I experience in a given period in the future based upon how much I exercise now via K and via gamma. Well, we're going to do a bunch of simulations, so we're going to use a quadratic form for the utility function. We're going to put some restrictions on the terms in that utility function so we satisfy these derivatives and a few other kind of partial derivatives. So the first result is, so we generate lots of random samples of our utility parameters, and then we ask and we then solve and say what's the optimal level of exercise in all of the periods, and then these are the averages across them as a function of gamma. So we'll then we'll re-optimize at each level of gamma, and basically what we see is that if you have trouble forming habits, most people, that's on the left, have a very low level or choose 0 in all of their periods. And if you're able to form habits and maintain them just sort of naturally, then your levels of optimal exercise are on average higher, with many fewer people just choosing 0 exercise. So that's a comparative statics for habit formation. Fixing my level of myopia at whatever level you want, you get this roughly similar kind of effect. So now we need to define theoretically what we're talking about in terms of nudges. So this is sort of maybe my cap U at time period 1 as a function of how much I exercise in time period 1. This is the optimal level that I choose. And this is what I'm going to call a nudgeable range. And what I mean by nudgeable range is the amount that U1 can change so that it's roughly negligible and I don't really care about that. Thank you. And that could lead to a big change in what I do in subsequent periods through this, how E1 translates through K into those subsequent periods. And that this should happen more when I can maintain habits better, when gamma is bigger. So the summary of what we find when we look at this for lots of different sets of alphas is that nudges, whether I nudge you up from what you would have chosen without a nudge or down, tend to reduce your total utility in the period that's getting nudged, because I get pushed off of what I would have chosen optimally without the nudge. From the point of view of the subsequent periods, having been nudged up can either increase or decrease exercise, because I can substitute away from exercising in the current period towards having enjoyment from having exercise, or in certain circumstances, if the habit's big enough and there's an interaction between what I do now and what I did before, then maybe I'll want to increase and I have enough kind of incentive to do that. And similarly for being nudged downwards, having been nudged downwards. So I can destroy or create habits with longer nudges. So not everybody will demand subsequent commitment having been nudged towards longer ones. And having been nudged up frequently increases utility, generally for people who don't exercise in subsequent periods because they can just enjoy what they have had. And frequently, but not always, decreases utility in subsequent periods when you've been nudged down. And that means that there's an ambiguous impact on welfare in all from the perspective of all periods within a person, and actually, since different people choose different optimal levels, there's an ambiguous effect across people, right, in terms of what the welfare implications are. If I have to pick a nudge, what's the number I'm going to show to all of you, since I don't know what your optimal level would have been for each individual. So this is an example that I'll show in the last minute or so that I have to talk. On the x-axis is the level that you choose in the second period. The vertical line is what you chose optimally in the second period without a nudge. And the blue line and the red line are what you choose in the third and fourth period respectively. So this person chooses something greater than 0 in the second period and 0 for the third and fourth period. And these are CAP U1, CAP U2, CAP U3, and CAP U4. And what you can see is that if I am nudged up slightly, it does not induce a habit, right? All of the subsequent periods stay 0. I'm unhappy that I've been nudged very slightly, and I'm from U2's perspective, and I'm slightly happier, very slightly happier to have been nudged up in U3 and from U3 and U4's perspective. If I had a big nudge, on the other hand, I can actually induce a habit. U2 is much less happy, so maybe they wouldn't have taken that nudge up, depending on what their epsilon is, and U3 and U4 are very happy. We can do the same sort of, this is sort of a similar example for somebody who starts out not exercising in any period. And this is an example where being nudged down reduces utility slightly in all periods, but actually increases the strength of my exercise in all periods, and being nudged up destroys the habit and makes me happier in the subsequent periods who have had their habit destroyed because they get to live on their past glories. All right, so what we're working on now is sort of finalizing the write-up on this, but what we show in our study is that habit formation occurs with greater frequency for longer nudge contracts. So we've randomized people to longer nudge contracts, but this isn't necessarily welfare improving, and it's very hard to tell. It's a very ambiguous, sort of inconsistent effect on welfare. So we can do this, but should we?